Did you know breast cancer is the second leading cancer for women? 1 in 8 women will develop breast cancer in his or her lifetime. An estimated 225,000 women every year will be diagnosed with breast cancer. What is cancer anyway? Well, a cancer cell is a cell that's lost its primary function in the body. Cancer is staged on a 1 to 4 scale, 1 being the least invasive, such as a breast cancer tumor. The most invasive would be a stage 4, and this means that the breast cancer has traveled to other parts of the body, such as the bone or brain. Knowing about breast cancer's risk factors and treatments are essential to fighting this deadly disease. Let's start with some risk factors. The number 1 risk factor for breast cancer is gender. Women are 100 times more likely to get breast cancer than men. Age is the next most common risk factor. A woman over the age of 55 is more likely to have an invasive type of breast cancer. The next most common risk factor is race. White women are more likely to get breast cancer than an African American woman. Genetic factors also play a big role. A person can be tested for a BRCA1 and a BRCA2 gene. If these genes are positive, the person is at 15% increased risk for breast cancer. Another risk factor is a person that has had a family member with breast cancer, whether it be their mom or their grandmother or their sister. If there is someone in the family has had breast cancer, the person is at more risk for getting it. Menstrual periods, if started before the age of 12, or menopause after the age of 55, also put an increased risk on a woman for breast cancer. This is because the woman has had excess exposure to estrogen and progesterone, which are known hormones to cause breast cancer in the body. Even when all these risk factors are known, a lot of people still develop breast cancer. There are several ways to treat breast cancer, including chemotherapy, radiation, and surgery. Let's talk about surgery. A person that's diagnosed with breast cancer can have a mastectomy. This means they have their breast removed. Also, along with surgery, you can do chemotherapy or radiation, or any combination of the 3. Chemotherapy, the most common treatment is adriamycin, Taxol, and cyclophosphamide. Chemotherapy is given in cycles and is typically given for a few weeks and then 1 week break, and then the cycle starts over. There are a lot of side effects to chemotherapy that should be watched for. Fatigue, weight loss, loss of appetite, nausea, vomiting, diarrhea, and hair loss. Also, mental changes can accompany chemotherapy, and these are among the most common side effects. These side effects typically go away after a few weeks after chemotherapy is completed, but some effects can stay with you forever. Radiation is also another treatment that can be used. This uses a high energy beam targeted to a specific site, in this case the breast. The radiation oncologist will design a treatment plan, and these treatment plans can range from anywhere from being Monday through Friday to just a couple of days a week. The treatment itself can last anywhere from 15 seconds to 45 minutes. The most common side effect to radiation is a radiation burn. It's a lot like a sunburn, but can also be more severe. Some of the radiation burns include redness, swelling, itching, burning, and peeling. Other side effects to radiation include fatigue and weakness. As you have seen, breast cancer can be a terrible disease, and it is very complex. Fortunately, new advances in medicine are being made every day to help us combat breast cancer. Knowing the risk factors and treatments of breast cancer help bring awareness to this disease. It doesn't have a cure yet, but hopefully with time and awareness we can find a cure.